Have you ever wondered about the hidden dangers of diabetes, the complications that lurk beneath the surface? This is an important question because diabetes is not just about high blood sugar levels. It's a systemic disease that can lead to serious, sometimes life-threatening conditions. One of these is macrovascular complications. This term might seem complex, but it essentially refers to heart and blood vessel diseases. People with diabetes have an increased risk of developing coronary artery disease, ischemic stroke, and peripheral arterial disease. This is mainly due to accelerated atherosclerosis, a process where plaque builds up in your arteries, narrowing them over time. The severity of these complications is not to be underestimated. For instance, coronary artery disease is the leading cause of death in those with type 2 diabetes. It's a sobering fact, one that underscores the seriousness of this condition. So the risk is real and the complications severe, but what exactly causes these complications? Diabetes doesn't play fair. It targets the body's systems, wreaking havoc on the arteries and leading to potentially deadly conditions. The culprits behind these complications are numerous and complex. For instance, the level of glycemia, or blood sugar, is a significant player. It's not only a risk factor for stroke, but it also predicts poorer outcomes for patients who do suffer a stroke. This is a double-edged sword where high sugar levels increase the risk and simultaneously decrease the chances of recovery. Then there's the role of HbA1c level, a measure of long-term blood sugar control. It's a significant and independent predictor of stroke risk. If your HbA1c level is high, it's like a ticking time bomb, increasing your risk of stroke. These causes can sound terrifying, but there are treatments available to manage these complications. So, let's not lose hope and continue our journey to understand diabetes and its macrovascular complications better. Despite the grim outlook, there is hope. Proper treatment can help manage these complications and improve the quality of life for those with diabetes. Let's delve into some of the treatments available. First, maintaining tight blood pressure control, ideally below 130/80 millimeters of mercury, is particularly crucial for stroke prevention. Next, early-stage diabetes without established cardiovascular disease benefits greatly from tight glycemic control. This means keeping blood sugar levels within a targeted range, which can delay or prevent complications. Another significant treatment strategy is maintaining a low-density lipoprotein cholesterol level below 77 milligrams per deciliter. Also, high-risk patients might need ACE inhibitors or angiotensin receptor blockers, which can help in reducing blood pressure and protecting the kidneys. And lastly, but certainly not least, smoking cessation is a must. It's a significant step in preventing further complications. With the right approach and treatment, it's possible to manage these complications. But we need your support to continue sharing this vital information. Knowledge is power. The more you know about diabetes and its complications, the better equipped you are to manage it. Your time and attention today are greatly appreciated. The power to spread awareness about the macrovascular complications of diabetes is in your hands. By understanding this condition, we can better deal with its challenges. Each share, each conversation sparked by what you've learned here, can make a significant difference. Imagine the impact we could make if all our viewers shared this knowledge with just one person. We're all in this together, and together, we can make a difference. Your engagement helps us reach more people and create more content that matters. So lend us a hand. Subscribe now to join our community. Give a thumb up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Share your thoughts, and let's create a healthier world together.